Recording in progress.
All right. Hello everyone. Good evening. Welcome to our internship virtual sharing session. We are delighted to have you all joining today with us. And welcome to our interns and then the host organization, our SEAOHUN colleagues, and then the secretariat team. So let me introduce myself again. My name is Maureen. I'm program officer at the SEAOHUN and responsible for the pre-service program, including this internship program. So today I will be serving you as a moderator for moderating this session. This is a special occasion and event for all of us as we conclude this year internship program by reflecting on and celebrating our internship accomplishment. So today we will be hearing the reflection from our interns about the knowledge and experience they have gained throughout their internship journey. Before we begin, let me quickly go over through our housekeeping rule. As you know, this session is being recorded. We will be posting this recording to our SEAOHUN website on our SEAOHUN YouTube channel. We request that your microphone and then the audio to be muted throughout the session. And please feel free to use your chat button and also the transcript that you can click under the show caption button. And you can also find the agenda, which I have shared in the chat box. All right. Okay, so to officially begin our meeting, I will be starting with the first agenda item. Please allow me to invite Ms. Anti Rismayanti, our regional program manager, to deliver the opening remarks, including the acknowledgement word to host organization. Anti, the floor is yours.
Yes, thank you, Maureen. So, very good afternoon. It's quite late afternoon, actually. Good day, everyone. So, my name is Anti Rismayanti, as Maureen mentioned. My role in SEAOHUN Secretariat is as the regional program manager, and it is my great pleasure for me to welcome all of you to this sharing session webinar. So on behalf of the SEAOHUN Secretariat in Chiang Mai, I'm honored to speak on this occasion as our Executive Director, Dr. Thongkorn Miam, is unfortunately unable to attend our event today due to the conflict schedules of another event in Hanoi. So I would like to extend a warm welcome to all of our interns, host organizations, and also One Health University Network, all OHUNs, representative joining us today. This event marks a special moment for the SEAOHUN 2024 Regional Internship Program, where our interns will share their unique, I believe unique experience from their time working with the prestigious host organization across Southeast Asia. This has been an incredible opportunity, especially for all of you, our interns, to immerse yourself in the real world One Health issues, and also enhance your skills and develop professionally. With the support of the SEAOHUN, as well as USAID in this program has placed 20 interns altogether for this batch in 12 host institutions across 7 countries in Southeast Asia, running for a period from 2 up to 4 months, starting at the end of May, and we'll be finishing for the last one will be in October this month. So I'm delighted to share that 19 out of 20 interns have already completed the internship. And we have one remaining interns from Vietnam who is expected also to complete her internship by the 21st of October in Malaysia, specifically in University of Terengganu. So I would like to take a moment to express our deepest gratitude to the host organizations that have played a pivotal roles in the success of this program. Your mentorship, guidance, and dedication have allowed this future young professional to gain invaluable experience, contribute meaningfully to your work. I would like to acknowledge the following host institution. First one is International Federations of Red Cross and Red Crescent Societies Country Cluster Delegations for Indonesia, specifically located in Jakarta, and then National Coordinating Office, Indonesia University Network, Indohun, also Laos Oxford Mahosot Hospital, welcome, Trust Research Unit, Lomru in Laos, University Malaysia Sabah, University Malaysia Terengganu, and then our next host is Ateneo Center for Research and Innovation, ACRI, Ateneo Schools of Medicine and Public Health, University of Manila, the Philippines, and then Southeast Asian Ministers of Education Organization, SEAOHUN Philippines, College of Public Health, University of the Philippines, Malaysia, Manila, and Tropical Disease Research Center, the TDRC, Faculty of Veterinary Medicine in Konkan University. Also, Department of Veterinary Public Health, Faculty of Veterinary Science, Chulalongkorn University. Yeah. Faculty of Veterinary Science, Mahidol University, particularly in laboratory of antimicrobial resistance, and Faculty of Veterinary Medicine, Vietnam National University of Aceh as well. Last but not least, our host located in Hanoi is National Coordination Office, Vietnam One Health University Network of Focus. So to all of these hosts, your efforts have been instrumental in guiding these 20 interns through their journey, providing them with hands-on experiences and a deeper understanding of the One Health approach. This partnership between us, the SEAOHUN Secretariat, also with the OHUNs, as well as with our host institutions, reflects the collaborative spirits of One Health as we all work together across sectors and to achieve better health outcomes for people, animals, and environment. To our interns, you are future leader, and today is a very wonderful opportunity for all of you to reflect on your learning journey since the beginning up to the end of the internship period, and share with us the highlights of your experience. I'm very excited to hear about the projects that you have been work on, the lessons you've learned, and your, of course, future plans. Yes, plans for the future. So, yeah, I believe that not only me but everyone here excited to hear from all of you. So, and this program is not just a stepping stone in your professional career, but also a chance to contribute to the larger One Health community. As I believe that within your onboarding in these host institutions, you also, in the same time, you also build a connection network, not only with the host institution, but probably with their network as well. So your network is now growing. That I believe will be also benefit in the future. I'm confident that experience that you have gained will propel you forward as a future leaders in this field. And I hope that you will stay connected with SEAOHUN and continue to engage in future opportunities. As we move forward, please stay tuned to our social media channels, also website and email, as we have many exciting program and activities in the pipeline for started, from next month onwards. So thank you again to everyone for being here today. And I look forward to an inspiring and insightful session. So let's continue to work together to advancing the One Health mission and build a healthier, more sustainable world for all. Yeah. Thank you. Back to you, Maureen.
Thank you so much, Auntie. Thank you for conveying your warm welcome remarks and acknowledgement word to our host organization. Okay, so as we move to the next agenda item, I would like to request everyone to turn on the camera as we will be having a short, brief photo session. All right, so let's give a few seconds that people are trying to open their camera. Yes, okay, so I think we have a complete one in the first page. Are we ready to have a photo? I'm gonna count 1, 2, 3, and then all right, have a snapshot. Okay, starting 1, 2, 3. Oh, sorry. One more. 1, 2, 3. Okay, next page. 1, 2, 3. All right. All right. Thank you so much for participating in the photo session. We will be sharing this photo by the end of the webinar. So now we are coming to the most excited part of our agenda. We will be hearing the reflection and experience sharing from our 20 interns. So each interns will be invited and will be given 3 minutes to present their experience and then to share about their key takeaways from their internship program. So we are eager to hear about the new skills, challenges, and insight that you have gained throughout this internship period. Basically, the interns will be requested to provide the highlights of the internship program by mentioning like 3 activities or projects that they have been involved and being impactful to them. Secondly, the lesson learned they have gained from this internship. And thirdly, what is the next, the plan that they will be involving and planning for their One Health journey. So I would like to request the audience to feel free to drop the questions or comments in the chat. You can feel free to use and communicate throughout with the chat function. So firstly, let's begin by inviting the interns from IFRC Indonesia. I would like to invite Ms. Abelia and Ms. Orla from IFRC Indonesia. If you are ready, yeah, the floor is yours.
Can you see my screen already?
Yes, we can see.
Okay. Over to Alia.
Good day, everyone. My name is Alia, and I'm here with my friend Abel. Today, we're so excited to share how our internship with IFRC allowed us to see the One Health approach in action. I'll start with one of my favorite experiences, the Global Health Security Partnership Workshop. Next, please. So the global health security is basically about building countries' capacity to prevent, detect, and respond to emerging infectious disease threats, often through the One Health approach. At GHS workshop, I worked with global and national stakeholders such as WHO, FAO, and as you might see on the screen, we also have the IndoHUN posters and GC to discuss the strategies for strengthening global health. Sorry.
Sorry to interrupt. Yeah, I think we have heard the echo in your background. It's a little bit noise.
Oh,
Can
I'm
you
so
try to,
sorry.
yeah,
Uh, if I move closer, is it
louder?
better?
Yeah, maybe louder, please.
Okay, thank you. So we'll discuss the global health security strategies, and I support my host organization, IFRC team, in preparing documentation for project showcases. You can see in the next slide. This is our poster for the Community Epidemic and Pandemic Preparedness Program, or what we call CP3. Next, please. And this is me and Abel in the left. So we're presenting IFRC's climate change activities for the next work plan. And in the right is the whole GHS family in Indonesia. Next, please. So the next highlight is also one of my favorite, the CP3 Communications team visit. This activity aims to capture the success story of CP3, celebrate the dedication of community volunteers, and preserve this story for advocacy. I supported IFRC Geneva by preparing the facility and facilitate the visit, providing technical support to document the project from the field. This experience showed me how vital community-driven efforts are in preventing epidemics. One of the stories we captured was about anthrax. You can see it in the next. Yes, we have capturing story about anthrax in Boyolali, how the community tried to stay vigilant, though the cases happened 2 years ago. We also capture how the government partners' perspective about these programs. And I offer to Abel.
So on my side, one of the highlight of my internship is when I do the CP3 CAP knowledge attitude practice survey, where on this activity I was actively involved in providing samples frame for 2 villages and 12 sub-villages in Maros, South Sulawesi, using simple random sampling method in a very tight timeline. This sample frame provides a smoother process in data collection. I was involved in data collection in Maros, South Sulawesi, visiting 2 villages, which is Tanrang and Samangki village. The extreme difficulty in accessing both villages depend my appreciation for the dedication and hard work of the PMI or Indonesian Red Cross volunteers even more. The second one is the Indonesian Red Cross volunteers called SIBAT joint training in Kebumen, Central Java, where the joint training is about outbreak control and community-based surveillance. On this event, I had the experience to be a co-facilitator for one of the session, which is Introduction to Infectious Disease. This training session was attended by more than 90 volunteers from all across Indonesia. During the session, I had the chance to lead discussion regarding different kind of infectious diseases, emphasizing in zoonotic disease such as avian influenza, leptospirosis, rabies, and anthrax. Overall, the discussion went very well, and the participants were very enthusiastic during the session to know more about zoonotic diseases and One Health concept. The second one is my lesson learned during my internship. The first one is the close collaboration between national and local government. From the project aspect, from CP3 implementation, I acknowledge that close collaboration with the national and local government also played a very significant role in the implementation of One Health in Indonesia. The availability of CP3 volunteers acted as the enabling factors to establish coordination between human health and animal health authorities' roles. And then the second one about the project management skill in developing project new phase. So I learned to develop theory of change, or TOC, by identifying program output, outcome, flagships, and related activities to achieve program goals, defining project scope of work, and coordination with donors and related stakeholders, knowing that the CP3 program is going to enter the next phase in a few months. Over to Aulia.
And also from all of that wholesome experience, I also learned that adaptability in public health program is the key, that whether we're adjusting to climate-related health risk or responding to disease outbreaks, flexibility is very crucial in approach. And the second, I also learned how the power of community trust is very important. CP3 showed me how empowering community volunteers to promote health, report alerts, and prevent disease by themselves build trust, and it making the public health efforts more effective and sustainable. So what's next for me is, as I move further, I'm more interested in health informatics. It was through my internship that I became aware of the crucial importance of data in preventing and responding to outbreaks. Health informatics can contribute to a more systemic approach for epidemic preparedness as it bridges human, animal, and environmental health sector. I'm excited to dive into the ways that data-driven approaches can be game changer in global health strategies. And I over to Abel.
So for me, this internship has equipped me with project development skill, a very crucial skill to have to contribute in non-governmental organization setting. Project development skill are crucial in NGOs as it directly contributes to the effectiveness and success of program aimed at in addressing various social, economic, and environment issues. This internship also improved my knowledge in One Health approach, especially in national, local, and community context, where close coordination in various stakeholders is the main key to sustain the approach in community level. My goals are defined into three categories, which are the first one is the short term, where I will explore more to build professional experiences in NGO setting. I will be involved in leadership roles where I can inspire others, actively involved in managing projects, and also drive innovations. My midterm goals is to improve capacity in public health for development, where I will be able to address critical health challenges, especially in infectious diseases, including zoonotic, and find groundbreaking solutions for underserved communities in low and middle income countries. And then my long-term goals is to be a leader of public health practitioner and also a lecturer. I am aware that the path to achieving my career goals will not always be smooth. There will be obstacles and setbacks, but I am determined to face them with resilience and a positive attitude. My strategy is to remain focused on my objectives, seek advice from mentors, and continuously evaluate my progress. That's all from us. Thank you very much, everyone. Back to Maureen.
Thank you so much, Alia and Abel. It was very great to hear about your internship experience, and I hope we are having quite a inspiration from your story. All right, yeah, let's give a big applause. All right, so as we continue on, we will move on to next team of the interns from Indonesia. So I would like to invite Ms. Wafa, Putri, Ms. Nuru, and lastly, Ms. Chanakan from the Indonesia to share about your experience. Yeah, the floor is over to you.
All right. All right. Good evening, everyone. So, we are from the Indohun or Indonesian One Health University Networks. We are the interns, working with Indohun for the last 3 months, and here is our internship takeaways that we would like to present to you. First, let's me continue introduce you to Indohun. What is Indohun actually? So it is the multidisciplinary collaboration in human and animal and environmental health sectors in Indonesia that provide to the collaboration support the policies and conducting the research and community outreach, which we are the parts of each project, and would like to present you what we've learned by far and what are the highlights of our internship. So let's start with Siri.
Okay, thank you, Pang. Can you next the slide? Can you next the slide, please?
Right.
Yeah. So this is my highlight of the activities during my internship in Indohoon. So my top highlight from the internship was being the content strategist and creator for in the Indohoon Instagram account from June, July to August, where the most viral was post for World Zoonosis Day in collaboration with the USAID Instagram account as shown in the top left, and the most liked post was about orangutan, shows in the bottom left. I had great teamwork with my coworker in the communication and networking division, and we enjoy involving all Indohoon officers as well as talent for the Indohoon video content. I also enhanced my writing skills and health communication knowledge by assisting the communication and networking team with a scientific article on the impact of mental health. On mental health content on Gen Z, which was submitted to the INT UNIR conference. I also organized Indonesia's Independence Day celebration on Indohoon, or it's called Indohoon 17-an, by planning the event concept, preparing prizes, decorating the venue, and serving at PMC. I worked closely with my coworker, and the event was a success with everyone having a great time. And you can also watch the recap in the Indohoon Instagram account as shown in the top right. And on the right side are all the community and networking division photos, including one where my manager and coworker gave me a chocolate bouquet at my graduation too. So yeah, that's all my highlights.
Okay, then next to my highlight in my internship experience, so I was assigned as the person in charge for Indohoon Knowledge Management System development. So this project aimed to establish a user-friendly and efficient platform dashboard in Airtable for project activities and activity programs, resulting in more organized and well-distributed data for Indohoon internal use. So my main task was to organize data into Airtable dashboard. This data including participants' data and also documents like reports and rosters, and also training materials, as well as documentations of the activity programs. This knowledge management system is also serve as information center for the Indohoon internal team who wants to access statistics of the programs that have been held by Indohoon. And also once the database and interface was established, I held a user testing for the interface in order to evaluate the user friendliness and also to gather feedbacks from Indohoon team members for the interface improvements, and as well as to ensure the sustainability of the interface program. And also I help and contribute to give feedbacks to WAFA as a development of Indohoon annual report.
So next is my internship highlights. So for this here are the pictures that were taken in Unmu, or the event organizing to the opening ceremony of the OHGC Unmu, and I had the opportunity to participate both in the communication team and also the technical team, and to be part of the teams to also collaborate with the Unmu to open the event. And also I have learned so much by this, and not just the communication strategy, but also the project management collaborated with the team of the Indohoon.
Hello everyone, my name is Wafa, and during the internship, I was assigned to Monitoring, Evaluation, and Learning Division, or we call it MEL Division. And during the internship, I had the opportunity to become the person in charge for the first Indohoon annual report. And then I assist Nurul, my fellow intern, to establish the first IndoHUN knowledge management system. And actually, that was my first time using the Airtable platform. And the last one is I had the opportunity to improve my communication skills by participating and leading several meetings between IndoHUN Mel Division, IndoHUN managers, One Health Laboratory Networks, and other stakeholders. Back to Peng.
All right, thank you. So let's move on to the lesson learned that we have achieved by far. So the first one is we acknowledging the mistakes without fear. So what we try to tell you about this is it is like the opportunity for growth and skill refinement and a continuous personal and professional improvement through the feedback and self-reflection from the team, and also that you can work by yourself, and also it is the teamwork that is very essential for accomplish any task ahead, and it is also crucial to have a good communication skills and try to understand the people around you. So what we try to say is to work alone is not really it's not really try to accomplish what the overall is needed. So it is to work as a team and also to acknowledge the mistakes. It is the very good lesson learned from IndoHUN and our work as a whole. So here's what's next. So let's start with Suri.
Okay, for the next thing that I want to do is continuing my career as a health consultant while focusing on health workforce strategy and planning, while also pursuing a master's degree in public policy in the next 2 years to apply this knowledge where I gained from IndoHUN to health sector management within the public policy framework.
Next to Wafa.
Okay. For me, I am planning to become a lecturer and researcher who contributes to make a better world by conducting research in public health. I also want to teach health students about core competencies in One Health. And in the short term, I am planning to pursue a master's degree in epidemiology within the next 2 years. Next to Nurul.
All right, so for me, my next plan, short-term plan, is to undertake a clinical year to obtain my DVM or Doctor of Veterinary Medicine degree. I believe that by obtaining this degree, I will be able to gain so much more opportunity and responsibility that can lead to my personal and professional development. And also, I will also plan to take a veterinary public health related internship as a part of the clinical year also, and also aligned with the new skill that I have learned during this internship. I forgot to mention that actually this is also the first time that I learn how to use a platform to build a dashboard, to build a database or knowledge management system. So in the future, I hope that I can develop that skill further and participating to developing a One Health-based integrated disease database. Thank you. And next to Janakan.
Right. With the original degree of social policy and development, I actually plan to pursue the master degree in public health management and also the public policy to for the further knowledge of the health management that could be beneficial to cross-disciplinary study. That is by learned with the IndoHUN. So this is very inspired, and we all inspired to pursue our degree and also pursue our career path in the health segment. Thank you very much for your participation and for your listening. Thank you.
Thank you so much, IndoHUN interns. It is truly inspiring. Yeah, thanks a lot for sharing your experience, and we are also really inspiring to learn how to hear how much you have learned and grow over the course of your internship. I really like the phrase you use, not to walk alone, but to walk as your team. So which also reflect the disciplines of One Health that we are working in this area. So I believe, okay, please feel free to use the chat to, share your comments, questions, or feedback. I could see the comments from Dr. Dui. Thanks a lot for your comments. Okay, so as we proceed, we're gonna have next interns from Laos, Mr. Somse Davyong from Laos, who did the internship with the Lumaru, Lao Oxford Hospital Wellcome Trust Research Unit. Okay, Somse, if you are ready, I'm gonna give the floor to you.
Yeah, I'm ready.
All right, okay, please go ahead.
Uh-huh. Can you share the screen here?
Yeah, we haven't seen your screen yet. Can you try sharing your screen?
Yeah, I can share the screen here. Actually, I uploaded in the website that you sent me already.
Oh, all right, okay. Let me check. So do you want us to share your slide?
Yeah.
Okay.
I can do it, Maureen.
Okay, Jericho, thanks a lot. Please, can you help? I think you need to download the new slides from the SharePoint.
Can you see
All
it
right.
now?
Yes, we can see.
Okay. So first of all, I would like to introduce myself first. My name is Somsai Dadiwong. I was doing my internship at the Lao Oxford Multi Hospital Wellcome Trust Research Unit. I had been there for 3 months. Yeah, basically, Lomlu conducted clinical research according to infected disease. Next. Can you next?
Sorry. It's tough. I'm sorry. Okay, let me share.
Before we go to the activity, the highlight activities, I would like to introduce my supervisor first, Dr. Matthew Vincent, the head of molecular, and also the other people is the molecular team who had helped me through my 3-month internship very well. Next. So the first highlighted activity was laboratory work. I was responsible for extracting DNA and RNA from animal samples such as stool, blood, electro swab, auto swab, and also conducting PCR assay to identify pathogens. And this will give me critical lab skill and prepare the sample for sequencing, which deepen my understanding of genetic analysis. So the second highlight activity here is joining the board lounge. So I joined the board lounge daily where I collaborate with other doctors to discuss patient cases. It was fascinating to see how lab results were applied in clinical decision making and reinforce the connection between laboratory work and patient care. So this internship is not only an academic experience, but also a personal growth. I learned a lot from my supervisor and colleagues. So first one is communication skill. I work a lot with the lab team and supervisor, improve my communication skill. For example, my supervisor always make sure I understood the procedure before I implemented them, and also time management. So balancing multiple tasks was challenging. I learned to prioritize effectively. For example, I joined the board Laos at 10 a.m. and I make sure to finish my lab work earlier and return to review the result later. And one of the major takeaways was seeing how human, animal, and environment health are all connected. For instance, I saw an increase in myelinosis cases during the rainy season, which highlight the role of environment in disease transmission, and also while studying capillary pneumonia from animal samples, I found it being linked to hyperviolen, raising concerns about genetic transmission. So looking ahead, this intern has solidified my interest in pursuing higher education in microbiology or public health. I'm particularly motivated to continue working in one field because the internship was showing me the critical role of interdisciplinary approaches to health insurance. I plan to further develop my research skill, particularly in writing research proposals and applying for grants, as I aim to contribute more to scientific research and public health in the future. Thank you.
Thanks. Thank you, Samse, for sharing your internship journey and then the lesson learned you have gained from this internship. It is quite inspiring. Thanks a lot, Jericho, for sharing the screen as well. All right. Okay. So we're gonna move to next Kim. We will be having Miss Nafaziza and Miss Amira from Malaysia, who did their internship at the Faculty of Medicine and Health Science at the University Malaysia, Sabah. So we will be hearing their reflections and then their experience sharing from them. All right. So Amira and Nafaziza, if you are ready, please feel free to go ahead.
Hello, can everyone hear me?
Yes, you are audible.
Assalamualaikum and a very good evening to everyone. So I am Amira Denenang Iswiti Jamain and my internship mate is Nurfasika binti Matwan. Next. So without further ado, for the activities, actually, we have most of the time we do the activities together. So we compile 3 activities for us to present today. So for the first activities is the rabies project. The rabies project is actually my project where we do a survey in 2 locations, which is in Pitang and Kudat, which is also from one end of Sabah to the another end of Sabah. So we actually basically do a survey we meet with a lot of people in the public spaces. We go to house, and yeah, that's basically the rabies project. So the next project is next. Next, please. The next activities is that we go with CMP student, which is community medicine posting student, to do their health promotion. So during this health promotion, we do about hypertension. We open many booths, healthy booths for the villages in Kudat, and for this closing ceremony, I was the MC of the program, and Fasiha is doing the registration process of the event. Next, I move to Fasiha.
Right, thank you, Amira. So I will proceed with our third project. Can everyone see the third slide? Sorry
No,
for
I think we are seeing just health promotion slide.
I'm not sure why it went next. Go next. Wait,
Can you reshare the slide? Maybe restart. Oh, it's moving now. I think it's changing.
All right, sorry for the inconvenience. Okay, so I will continue. So for our third project, we were working with the climate change education module that aim that aim amongst primary school students. And this project was we are creating an engaging content, which is a comic storyline that features international characters from four countries: Malaysia, Brunei, Indonesia, and also Philippines, and also include the superhero Captain Planet. This module highlight key concepts such as the basic concept of climate change, and also the mitigation and the adaptation strategies. And our main aim for this project was we want to instill the knowledge within the primary school student in an engaging way, because we also design the interactive component at the end of every chapter in the comic. All right, so we will move on to the lesson then. But again, it won't moving. Okay, sorry. Okay, so there are many lessons that we have learned throughout the journey, but here we highlighted some of the most impactful lesson that we have gained. Okay, so for the first one is the support system. So from this internship experience, I learned that the importance of having a strong support system, whether it was both from guidance from our supervisor and also the collaboration with the fellow intern, because it will build the resilience in ourselves, and also can help me to navigate any challenges, and also to help me to grow professionally. And the second one is community engagement for effective research, because in Sabah, conducting research in conducting research in Sabah to address the public health that was, I think, quite distinct from Peninsular Malaysia. It was quite necessary and very vital because when we actively involve with the local community, it can help us to gain insights into their challenges and also their perspective, and it can help us to understand their challenges better. Okay, and the third one is the adaptability in field research. Conducting field research has taught us to be more flexible, and we need to adapt to the unpredictable circumstances. We have learned that we need to quickly adapt to the current situation, and we need to adjust our plan accordingly based on the current situation and also external factors. Right? Alright, next one is stepping out from comfort zone. Okay, as for me, I am from Peninsular Malaysia. I think at first conducting research in Sabah was just similar with Peninsular Malaysia, but I was wrong because Sabah is quite different with Peninsular Malaysia with its diverse culture and its unique and challenging experience compared to my previous work in Peninsular Malaysia. So and the next one also is empathy and cultural sensitivity. I've learned that when we are working with diverse group of people, it somehow increase our awareness of their different cultural perspective, and we need to instill our empathy and the sensitivity towards their culture in order to make us to communicate with them effectively, and to make our goal and to make us to achieve our goal easily. And the last one is we have broadened our worldview because we have engaged with many issues, with many public health issues in Sabah, and it somehow make our eyes wide open with many pressing public health issues that need to be addressed. Right. Next, I'll pass to Amira again. Wait,
So for the future plans, as of now, I am pursuing my master on the rabies project. As we undergo SEAOHUN program, I think it is a shame if we don't like continue the project, the rabies projects, since the villagers themselves said to me that this is a good thing. This is something that is good for people and for our community. So I took the chance to actually pursue master on this project.
Right. So for my part, I plan to pursue my next internship as my scheduled study plan at Kazana Research Institute, which I aim to deepen my understanding on research methodologies and also policy analysis related to One Health issues, sustainable development, environmental issues, and also public health. And I believe that this opportunity will allow me to apply all the skills and knowledge that I've gained during my current internship to the upcoming work. Right. So that's all from us. Sorry for the inconvenient cause. Thank you.
Thanks a lot. Let's give a big applause to Precisa and Amira for their nice presentation. Very cute presentation. So I really learned a lot from you about your PE experience and also lesson learned from your life experience, talking about the stepping out of the box. So which is very important, I believe. All right. So we're gonna move to next intern. I would like to invite Miss Tu Pham An from Vietnam, who did the internship with the Malaysia University of Terengganu. Currently, her internship is still ongoing. She will be doing for 3-month internship and will be completing by this month, by 21st October. All right, all right,
Hello, can you hear me?
Yes, we can hear you. Are
Okay,
you ready to share your slide?
Yes, I'm sharing my slide.
Okay.
Okay, so thank you, Miss Mao, for the introduction. Hello, everyone. Let me tell you about my wonderful 3-month internship experience in UMT. So about myself, my name is Anh Thư, and I'm a veterinary student from Vietnam. I aim for my future career to be a wildlife rescue veterinarian. I chose to intern at University Malaysia Terengganu to learn wildlife research and to be acquainted to marine conservation. And to say the least, I am more than satisfied. UMT is most famous for fishery and marine science. It lies in the beautiful coastal city of Kuala Terengganu. Okay. Wait. Okay, it lies in the coastal city of Kuala Terengganu, east coast of Malaysia. So these are the main project that I did in UMT is the Citero project, where I sample the Citero blood and analyze hematological indexes to assess the health of the Citero as well as the health of the marine environment. The second project is where I put my skills as a veterinarian to use and help others with dissecting lab rats. And thirdly is a mini project on oil palm byproducts as possible animal feed. So what did I learn in UMT? I experienced so many first time in the past 3 months. I handled 100 kilograms wild ceteros. I took blood and tissue sample from wild boars, and I significantly deepened my knowledge on cytology, histology, and lab techniques like DNA extraction, PCR, blood count, proximate analysis, and I have deepened my knowledge of marine life. The skills I find to be the most critical when doing research are problem solving, teamwork, and time management. I was very lucky to be under guidance of a passionate, considerate, and open-minded senior. He becomes a role model for me not to be discouraged by problems arise, to utilize my time and not to be passive towards situation. And most importantly, to organize a team and to have trust in my teammate. It was a new experience for me to live in a multicultural environment. We learned to find a lot of things we have in common, like a life lesson, relationship preference, shopping and singing. And I found myself so proud of having a diverse group of friends and enlarging my social cycles. So here's something that opened my awareness. Did you know that each drop of seawater is full of lives? I saw an empty frame drop in the sea for 1 year and it can magically grow branches of coral and be home for hundreds of fish. Then I am sad because the common mindset where I'm from is that the sea is so vast and it's like infinite. So people dump trash into the sea for it to be washed away. And now I wish people could see like I do, and that the ocean is one, it is whole, and it is lives. And the trash they dump to the sea will harm lives in many forms. This is me under the water. So lastly, I would like to say that the highlights of my internship is the sampling trip to Redang Island. For my near future, I want to continue studying Citero in Vietnam and to correlate with what I've learned from Citero in Malaysia. In the far future, I want to become the top wildlife vet expert in Vietnam and collaborate with international wildlife conservation project. And that is all for my sharing. Thank you for listening.
Thanks a lot to you. This is very interesting to learn about your experience and your project that you are doing with the contribution at the wildlife conservation, which is very interesting to learn. All right, I believe this will be very helpful for you, and then you could apply in your future career. Okay, so as we move to next intern, we have Mr. Christian from the ACRI, but unfortunately he couldn't participate today due to his health concern. So I will be skipping him. Instead, I will be inviting Mr. Mark and Mr. Ivan from Simeo Chomet, Philippines, to give your internship experience, sharing about the project you have been involving. Yeah, for Mr. Ivan, he informed me that he won't be able to join, but we will be sharing his pre-recorded video by the end of Mr. Mark presentation. Mark, if you're ready, please feel free to go ahead.
Hi, am I audible?
Yes,
Okay.
we can hear you.
Okay. Prior to my internship with the SEAOHUN, I knew little about One Health. To me, it was just another catchy term in the jargon of public health. However, everything changed when I threw myself into a rigorous 3-month journey of research, learning, and hands-on experiences. Good evening, everyone. I am Mark Jones Arugay, a 2024 SEAOHUN intern from the Philippines, and I'm so pleased to share with you my internship journey entitled From Theory to Mission, a Transformative Journey in Public Health. At first, I thought of One Health as something theoretical, a distant concept that could aid us in the prevention of future pandemics. But early on in my internship, I realized it was far more urgent and practical. From participating in the first intensive training course in malaria diagnostics to helping in processing stool samples for zoonotic schistosomiasis project, and finally to finishing my project plan proposal, I learned more than just about these parasites and diseases, but also how these health issues are deeply interconnected with the animal and environmental health. And with all the internship activities I've been through, I've learned 3 main important lessons. First, my participation in the malaria diagnostics training reinforced in me the importance of early detection and diagnosis in disease control. Second, I got the chance to talk with Dr. Eva during her presentation entitled Developing Filipino Health Scientists Through Capacity Building, and her talk made me realize that by providing individuals with the necessary skills, knowledge, and competencies, we can help ensure that we will have a resilient and more effective public health workforce. And lastly, working with my project plan proposal made me understand the crucial role of evidence-based practice in public health. This means that if we rely on scientific knowledge, then our public health professionals can ensure that their interventions are grounded with sound data and it will be effective when implemented. So what's next now? Actually, before my internship, I was actually torn between pursuing a career in medicine or a research. But SEAOHUN clarified my vision. The more I engage in it, the more I realize that my passion lies in the research and development side of public health. And this internship has taught me that the best way I can contribute to society is through research, innovation, and education, especially in the fields that are often overlooked but are crucial to the health of vulnerable populations. I could say that this 3-month internship journey was indeed challenging. It did not only expanded my technical skills, but it has also developed a greater sense of responsibility and urgency in addressing health issues, not only in my home country, which is the Philippines, but also in the whole Southeast Asia. The connection between the animal, human, and environmental health is now something that I fully appreciate and I'm really eager to contribute to this field moving forward. This internship has not just prepared me for a career path in public health, it has also strengthened my resolve to continue helping improving the health of those who are most vulnerable. And I could probably say that One Health isn't just a theory anymore, it's a personal mission. That would be all. And if you want to stay connected, you can follow me on Instagram or we can connect in LinkedIn. Thank you so much for listening.
Thanks a lot, Mark. Which is very inspiring. Yeah, I really love the quote that you reflect what that One Health is not just a theory; it's a personal mission. Yeah, of course, we believe that that this internship has opened your eyes and paved the way for your public health career and then the future endeavor. It is truly inspiring. Thanks a lot.
Thank you, Miss
All
Mel.
right. Yeah, Mark. Okay, so we're gonna share, I think, pre-recorded session from Ivan. He couldn't join, but I believe this video will be also giving some of the insight that he learned from his internship journey. Okay, thank you, Jericho,
Good
for
evening.
opening.
I'm Ivan Store. I recently graduated veterinarian assigned the Southeast Asian Ministers of Education organization, TROPMED, or the College of Public Health in UP Manila. So while we were there, we were tasked to help in the laboratory work conducted by the college as part of its mandate to help the San Lazaro Hospital and the Philippine General Hospital. We were taught how to perform basic laboratory diagnostic techniques such as direct fecal smear, thick, cuts, uh, circumoval precipitin test, and the formal ether concentration technique. But what I would say that the highlight of my time with them is the 5-day malaria training, where I got to learn about the malaria situation in the Philippines and experience a part of laboratory diagnostics completely new to me. So another is when I joined the 5-day fieldwork in Oriental Mindoro, conducted by the College of Public Health in collaboration with the Japan Society for the Promotion of Science for a study on the One Health approach in solving schistosomiasis in the country, where we conducted sampling and screening for schistosomiasis infections in humans and water buffaloes in the various towns in the province. As I mentioned, we learned how to perform various diagnostic techniques. And while all of these are beneficial to my career, I think what will serve me more are the interpersonal skills and etiquette in conducting field activities that I learned. During this internship, particularly the fieldwork, I was able to work with foreign and local experts in parasitology, as well as the local farmers and local officials of the agriculture sector. This not only gave me a chance to learn how to interact with them, but also form connections that may be beneficial for me in the future. So, what's next? Currently, I'm reviewing for the licensure exam for veterinarians, but after, I'm still firm on pursuing a career in veterinary public health. So once I get my license, I aim to pursue a career in epidemiology since I feel like it is still lacking in the country, especially in the animal health sector. I'm also planning to pursue graduate studies, which would further enhance my skills and knowledge to be able to contribute more to my field. So that is all. Thank you.
Thank you, Ivan. Thank you, Jericho, for opening the pre-recorded video. So that's all about the internship sharing from our Filipino interns. Next, let me move forward to another interns. Miss Long Beach Tran from Vietnam, that she did her internship with Faculty of Veterinary Medical Science or PubMed at the Concan University. So she did her internship for 3 months. So I would like to invite Lo for sharing your experience.
So
Thank you for your introduction. So can you hear me clearly? Okay, so good evening, everyone. My name is Loan, a veterinary medicine student from Nam Lam University, Vietnam. Over the past 3 months, I had the opportunity to intern at the Tropical Diseases Research Center and the Faculty of Veterinary Medicine at Khon Kaen University, Thailand, under the patronage guidance of Associated Professor Sirakachon. So today I'd like to briefly sharing my memorable experience during this valuable period. During my internship, I engaged in both academic and practical activities. Academically, I participated in classes on the One Health and also health concepts, and attended conference and also the scientific seminar focusing on innovation in animal health, human and also environmental health. How can they collaboration to solve the problem in the regions? Particularly, I was involved in two key projects. The first was the Laos model field trip, where I observed and the demonstration of a successful application of the One Health approach in controlling orbital cases across human, animals, and environmental health sectors. Was an valuable experience for me to see a real world scenarios how to approach One Health in the field. Secondly was the health project, which the full name is eliminating major health myths in NTD, where I had hands-on experience in field works from the preparation, prosection sample to the diagnostic lab works. Besides, I also conducted my project relating to the KB Knowledge Attitude and Practice surveys on the page owner awareness of the GI parasites in the specific areas. Uh, from the experience, what I have learned, uh, honestly, I have learned many lessons that I can tell today because the limited of the time. So I will briefly sharing my some of lessons that I gained. Firstly, it's a deeper understanding of the holistic One Health approach, particularly the integrated approach to the disease controls across multiple sectors. I also developed practical skills in clinical practice as a veterinary medicine, parasitology lab works, and the field works, along with soft skills such as the communication, interpersonal communication, as well as the social media communication, community engagement amongst many sectors like private sector to the national sector, and a holistic thinking, which is a very um, necessary skill for me in the future. This internship has also shaped my future plans. In the short term, I aim to enhance and develop the One Health multidiscipline framework among the universities, especially in my regions. And then I eager to contribute to some integrated approach for the recent project in my areas, especially to improve the rabies vaccination coverage rate in my country. In the long term, my goal is to become an expert in veterinary public health who can combine the knowledge of veterinary medicine and also the field research under my passion for the community health. Overall, this internship has provided me with a solid foundation, transformative experience, and I also committed to building on this experience to achieve my career goals. Thank you for your listening. Thank you so much, Lo. Thanks a lot for sharing your experience. I believe this is very also quite interesting that you involved quite a lot especially in the project of flower, and I believe that that this will be paving your way in terms of the expert that we like to great in the veterinary pathway. So I believe, okay, we're gonna move to next intern, that we have one intern from Cambodia, Mr. Vinkran, that he did his internship with the CU BUD at Chulalongkorn University. So I would like to invite Vinkran to give your presentation.
Yes, you can hear me. Can you hear me?
Yes, we can hear you.
Okay.
Can you? All right. Are you sharing the screen or is it okay?
It's fine. I can share by myself.
All right. Okay.
Okay. Can you see my slide?
Oh, not yet. I think it's still appearing.
Can you see my
Okay.
slide? Okay.
Yeah, we can see it.
Okay. Good evening, good afternoon, everyone. My name is Crescent from Cambodia. And today I am honored to share my experience during my 3 months at Department of Veterinary Public Health at Chulalongkorn University. During my internship, I was involved in 3 key activities that had particularly significant impact on my experience. One, collecting of sample, preparation of media, valuation of colony farming units to assess microbial growth and data analysis. And also, these my pictures about my activity. Listen learning. During my time in microbiology lab, I learned valuable learning from my supervisor that significant job to boost my health and soft skill with essence of advancing One Health initiative. Future plan. I am to further my education and research in interconnectedness, human, animal, and environmental health. I intend to pursue advanced studies that focus on disease prevention and health promotion through the multidisciplinary approach. Additionally, I aspire to engage in community outreach program that raise awareness about One Health principle and their importance in public health. Thank you so much for attention.
All right, let's all give a big applause to Vinkran. Yeah, thanks a lot for sharing your experience, which you done in a microbiology lab and advancing your hard skill as well as the soft skill. It's really pleased to learn. All right, so we're gonna have to next agenda, not agenda, yeah, moving to next intern. We have Miss Charisma from Malaysia, who did the internship with the University of Mahidol at the Thailand for 3 months. Yeah. So I would like to invite Charisma for sharing her internship experience with all of us.
I'm audible, right?
Yeah, your voice is a little bit soft. Can you speak louder?
And you can see my screen?
Yeah, we can see. Can you speak louder, please?
Okay, sure. Is it okay? So, I as Ms. Maureen said earlier, I did my internship at the Faculty of Veterinary Science at Mahidol University. And so the project that I worked on were mostly on the wet lab. So my project was the uropathogenic E. coli in small animals. So I was testing on the antimicrobial resistance and also looking at the cytotoxicity at the animal hospital. And the activities involved was collecting and testing on the virulence genes and also seeing the AMR resistant. And my third one was detecting the MCR genes, and finally was the cytotoxicity assay. So everything was, since I'm a genetic student, so it will involve more on the wet lab. So a rough introduction was we collected the samples from the dogs and cats. So it was on the UTI, so we tested on the UPEC. So as we are related to One Health, so I tested on the colistin to see whether they are resistant or not. So that were my activity that I work on, and we collected around 70 samples. So these were the picture where we collect the samples and we grow the E. coli on the agar. And then I also did some of the primers in order for it to detect and see whether the sample is actually resistant towards the antibiotic or not. And these were the primers that I designed. So I've never designed before when I studied my bachelor. So it was a new experience for me in this internship to see and learn how you're actually supposed to design a primer. And for antimicrobial testing, I did MIC, which is to see whether the antibiotic is actually resistant or susceptible to that sample itself. And from this, we worked on 7 different antibiotics. So from that, we get to see whether the multi-drug resistant is available or not towards the sample. And these were also a part of the primer designing to see the virulence gene. And then lastly, the toxicity was to see whether the toxic and the antibiotic was related to each other or not. So that were my project about. And apart from the wet labs, I also went to the ISA and SEAOHUN International Conference. And then the lesson that I learned as a professional in the scientific field was getting a lot of knowledge and hands-on practice on molecular skills. So because I work on DNA extraction, PCR, primers, and those actually help me to see how actually we're supposed to plan and execute in the lab work. And this one actually helped me to interpret and see my research data criticality. And then my soft skills was through communication because I'm from Malaysia and then I work in Thailand. So it actually deepened my knowledge and also learn to how to communicate with supervisors and also to work in a team. And in terms of One Health perspective, my understanding on the human, animal, and environment correlates. I get to understand more because we worked on the small animals, which is actually a dog and cat, which are pets. So from that resistance, we can also see the interconnected with the human as well. So these were my pictures I got it from my dean because we get a certification of completion, and this is my supervisor and my mentors. And also like to refer that on what's my next plan is actually on the project that we worked earlier. We are working on the scientific paper for publication. So I hope the research finding that I and my fellow did will help the hospital in Thailand and also to see their One Health and also especially in AMR. And also, finally, I would like to take a moment to acknowledge USAID and SEAOHUN, and as well my supervisor, Dr. Kampun and Dr. Natari, and my fellow mentors, Dr. Miu and Dr. Mua, and Miss Maureen also for the support and guidance throughout my 3 months journey at Thailand. So that's all from me. Thank you.
Thank you, Charisma. Congratulations for your accomplishment. And yeah, it's really great to learn that you have done quite a lot of research projects and got to explore in the area of One Health and then the interconnectedness of, working with the different professional, not just related to animal and also environment, also as well as the public health professional.
Yes.
All right. Yeah. Thank you, Charisma. Yeah, it was great to meet you at the international conference as well. Yeah. All right. Okay. So we're gonna have our Vietnamese intern. I would like to invite the interns from VNUA, Vietnam National University of Agriculture. Firstly, with the Miss Wayu Jadi from Indonesia, and together with Miss Pham Thi Ha from Vietnam. If you are ready for sharing your presentation, please feel free to take the floors.
Yes, Miss, we are ready now.
All right. Okay. So please go ahead.
Miss Tuha, it's your turn.
We can hear me.
Yes.
Hello. You can check the group. Yeah, good.
Okay. Hi, everyone. We are very happy and proud to be interns of the SEAOHUN 2024 Internship Program. And today we are grateful to have the opportunity to share about our internship experience. My name is Thu Ha, currently a student at Huế University of Medicine and Pharmacy in Vietnam. My companion is Yati from Indonesia. We have had a 3-month internship at the Vietnam National University of Agriculture. And today we will be talking about the highlight of the internship, lesson learned, and what's next. Now, I would like to invite Jati to continue with this presentation.
You can hear me, everyone here? Okay.
Yes.
Oh, it's okay. Next. So in 3 months, what we have learned so far. There are three function option, the main three function. In the first one is rural egg consumption behavior, and the second one is microbial analysis and QC, and then the third one is community engagement and survey design. So the rural egg consumption behavior project provide us with the opportunity to investigate food safety in rural communities by implementing protocols for egg storage and handling, which is significantly reduce contamination rates, and hopefully we can improve for the public health outcomes through the direct data collection using the laboratory techniques such as PCR and bacteria counting. We develop a skill in microbial analysis and QC or quality control. And then I highlighting highlighting the importance of the accurate data collection in research, and in additionally like the conducting a survey on egg consumption patterns demonstrated the critical role of community engagement in understanding health behaviors, and then demonstrating how effective communication and like the data-driven insight can inform to us like how far the impactful for public health knowledge. Next, okay. So the first one, the importance of data accuracy. And the second one is community engagement. And the third one is development of hard or and soft skill. So lesson learned, we have learned that the accurate data collection and analysis are critical to effective research, as demonstrated by the 25% reduction in harm during our study, and then highlighting its importance to public health, understanding local food safety, and the knowledge through the community engagement is really critical, I think, because it's connected with the community development. And then as it helps identifying the challenges and adapt the solution. And also we develop the technical skills such as laboratory technique, and then equipment use or equipment handling, and then like the non-technical skill also, including the communication, teamwork, and problem solving, that emphasizing the value of collaboration and diverse perspective in addressing public health issues. Next. So this is what next. It's your turn first.
For me, through this internship programs, I had the opportunity to learn and communicate in English with the teachers and students here. This has helped me develop natures and reflexively, and make me more open and confident when speaking in English. And I had the opportunity to work with students from animals, urban fields, and from different regions and countries. However, we freely exchange ideas, listen to, and respect each other's opinion to order to complete the works. Especially, I had the chance to chat and work with Jatis, and he is very nice. The internship at the Vietnam National University of Agriculture has a profound impact on my future plans and career goals. First, with visiting the habitat and Fiverr companies help me better understand the connection between animals and human health, particularly the disease transmits from animal to humans, thereby reinforcing the importance of One Health in disease prevention efforts. Second, participating in research on the genetic characteristics of arthrovirus in cats and antibiotic resistance in E. coli from chicken egg cell has enhanced my research, analysis, and laboratory skill. These skills are not only essential for my future cultural, but also help me gain a clear understanding of the response by antibiotic resistance, which is one of the measuring issues in public health today. From the experience, I feel more confident in choosing a specialized epidemiologist, and in clearly defining my research on and curious development path for the future. And how about you, Jati?
Okay. Thank you so much, Ha. Actually, I'm from animal science and especially in nutrition and feed technology, faculty of animal science. And then when I completed my One Health internship, I plan to pursue a career in a non-profit organization that focus on community development and food safety. And my goals is to apply my internship experience to like development the community-based programs that can improve in the food or feed for animal, like the food or feed safety, and like promote the safe food or feed handling practices. And I aspire to engage with the rural community and then community development because I can educate them about the health behavior and like the disease prevention, ultimately contributing to community development. And I would like to be able to engage in research initiative that can address the complex intersection of food security or feed security, like the international lens, nutrition, and public health to ensure my experience has lasting impact on underserved communities. And that's it. So for all, thank you so much for everyone here for the attention and also listening so far. Thank you so much, everyone.
Yeah, thank you so much.
Thanks a lot, YU and Tuha, and thanks a lot for sharing this wonderful presentation and then the experience and the lesson learned that you have gained from this internship experience. Yeah, that is very inspiring. All right. I'm aware that we are running over the time, but I believe we last not but least we have the two interns from Vietnam who work at the VOHUN Vietnam One Health University Network. I would like to invite Mr. Tia Quan Vu and Mr. Huan Ngo from Vietnam for sharing your insight about your experience.
Hello everyone, can you hear me?
Yes, we can hear you.
Yeah, I'm outside right now, so I cannot turn on the camera. Sorry for the
Yeah, it's all right. You can still
Yeah,
can
okay. So now me and Mr. Huy Giang Ho will share our experience during the internship period in Vietnam One Health University Network. Yeah, okay. So me and Mr. Huy Giang Ho had the internship from May to August 2024. And during our internship, we had experienced many wonderful activities and also learned a lot of lessons, which helped us a lot to guide our future path. Now let us commence with the highlights of our internship. So I will go first. During the first days of the internship, May 30th to May 31st, we had a workshop on developing the guideline for using the One Health multi-sectoral coordination mechanism assessment tool. And during this event, I was assigned to be the interpreter for Mr. Miat to Razak. And for the for me, the most notable event of my internship period, the One Health Student Club webinar between VOHUN and TOHUN. And for this event, I had the chance to be the moderator of the webinar, which for me is a wonderful experience. And now we move on to Mr. Huy.
I'm sorry, can you all hear me? Is it okay?
Yes.
Okay, right. So very nice to meet you all. It's been a long evening, so I will try to keep it as short as possible. So in this picture, I had a opportunity to discuss with Dr. Mietz, and it was a very nice discussion with him about the One Health and how is it important in Vietnam. It was a very nice, fun and cool occasions. So next on with the lessons learned from myself first. So my first and my primary goal during this internship is to create a promotion videos of One Health approach and how we create and how we stimulate the One Health approach in Vietnam. As you can see, I have a QR code right here, and you can scan it and have a look through it. And during the time, it was very tough. I must be honest, because we decided to create videos by ourselves. So I had to spend a lot of time to try to observing, try to discovering and learning new things, learning a lot of new applications for my first time to create videos. It was comprised of Canvas I use the most and DaVinci Resolve. So this is some pictures I use with Canvas, just some basic things. And this is some pictures I use with the DaVinci Resolve, the most two primary sources I use for creating these videos. And the second things that I learned, I think it's the most important one, is they always say that work-life balance is very important. But for me, because my first internship in my life, it was very hard to balance it all. Like the times I had to create for myself and for my work and for my life and more for my families, for my friends. I must be honest that I think that during the first month I was having I had very few times for myself, like working out and seeing my friends and my families. I didn't got to balance it all out. And I think that was a huge and major problem for myself. So I decided to look up some of the things to help me with that. And one of the things I can say that is Google Calendars. And I try to details all the things and all the meetups and all the things I need to do in a day, in a week, in a month. And it has helped me tremendously. I recommend this to all to have a serious and to have a balanced life in order to have a good mental health and good physical health, to dedicate yourself the most to the work. So I go back to the Mr. Huan.
Yeah, apart from the lessons that I also share with Mr. Hui, for me, I would never forget the experience acquired during the One Health Student Club webinar. To be honest, that was my first time to be a moderator for such a big and international event. For just a short period of time, I must learn how to control all the functions in Zoom, how to make participants feel comfortable and focus on the speech, and finally, how to stay calm when problems occur. 2 hours of the event made me much more confident in my presentation skill and understand more about the difficulties of being a moderator, especially a virtual one. The positive feedbacks after the webinar confirmed my determination and efforts I put in the job and helped me to be much more confident for the upcoming events that require me to be a presenter. And finally, for my future path after the internship, I am very grateful for the chance that SEAOHUN and VOHUN provided for me. 3 months were long, but it helped me to understand more about the working environment in the public health domain in general and One Health in particular. As for my future path after the internship, I plan to finish my degree at Hanoi Medical University and to pursue master and PhD studies in public health domain to become a professor in university and have the chance to be a full-time officer at WHO, thus be able to use my enthusiasm and knowledge to spread the positive impact of One Health to all over the world. Now back to Mr. Hui.
So for my future goals and for my future plans, I really want to. It's a big thanks to SEAOHUN because I had the chance to delve myself into this internship. I realized what I could be doing, what is my potential if I really tries to put myself and put my heart into what I do. So this internship makes me realize that I could try to I want to try to aim for the higher educations like a master and PhD later on, whether it's gonna be epidemiology or biostatistics. And I think that these two fields is gonna help me a lot to have a bigger view and a better view of what public health and One Health in general. So that's all for our presentations. I hope you had a I hope you had a great time today, and thank you.
Thanks a lot, Tia and Hai. Thanks for sharing your stories and about the lesson that you have learned, that you've been able to explore and using the media and in terms of promoting the One Health projects. And yeah, it's quite interesting that to learn about your lesson and also about your experience. All right, so it's we are getting towards the end of so we are having all of those interns completely presented about their experience. I hope this is quite interesting to learn, and we believe these reflections are quite reflecting not only towards the intern but also quite reflecting the success of the internship program. So I would like to give the time for questions and comments. I know it's we are running over the time, but please feel free to drop your comments, suggestions, or any feedback that you would like to provide. We are happy to read and we are happy to take note. So otherwise, we also have some announcement that we will be from SEAOHUN. We are also preparing their certificate of completion for the interns. That we will be coordinating with our host organization, and we'll be presenting this e-certificate to all of the interns. All right, so please feel free to use the chat to provide your any comments or feedback. Otherwise, I would like to move forward to next, agenda, the last agenda, because we are running over the time. So as we approach the end of our meeting, I would like to conclude, this webinar by inviting Auntie to give her closing words to our participants.
All right, so no more feedback or comments, Maureen. So let's proceed to wrap up our session today. So thank you everyone for such an inspiring and insightful sharing session today. And I'm truly actually impressed by the diverse experience, challenge, and also accomplishment that all of you, 20 of our interns from 7 countries have shared today. As Somsai from Laos PDR, Mark from the Philippines, and Wahyu from Indonesia just mentioned in their presentation, this experience has not only contributed to the academic growth, but also to the personal or even the professional development, including the technical and non-technical skills. So it is clear that each of you has met the most of your time during the SEAOHUN 2024 Regional Internship Program. And I want to commend you for your dedication and hard work from, some of you started from 2 months up to 4 months of the internship period. So also from your presentation, it is very impressive that within some months, engaging with the host organizations, you have through a lot of contributions on the laboratory works, field work, research, or engaging with local projects, as well as in other communication and knowledge managements of One Health related activities. So that I believe it is not only enhance your professional skills, but also deepen your understanding on the One Health approach. As you have, as you some of you mentioned, this program has truly opened your eyes to critical One Health issues. And as I also learned from your presentation, there is always a first time for everything, right? So I've seen from your presentation, some of you, have conducted this and that doing this and that for the first time, such as what who is it? Tu Fu from Vietnam have experience with dealing with the white boars, for example. This is never happened in her life, but this is you can have it. You can gain this experience in this internship program. So this knowledge and skills will be invaluable as you continue to develop in your careers. The One Health fields require committed professionals like yourself, our future leaders, who can bridge the gaps between human, animal, and environmental health to create lasting impacts. So I'd like to once again extend our sincere thanks to the 12 host organization that generously hosted and mentor our interns. And your support, guidance, expertise have played critical role in shaping these future leaders. And you have provided a platform for them to engage with real world One Health challenges and growth, both personally and professionally. So we are truly grateful for your partnership in this important initiative. And as we moving forward, this program won't stop. Then in upcoming months, we will open the new batch, and also we would like to welcoming our current host. If you willing to accept more interns, or even if you have some within your networks that also willing to accept our interns, please do not hesitate to contact us and connect us also with them. And to our interns, I hope you will carry the valuable lessons and experience you've gained from this program as you embark on the next step of your journey. I have heard many of you share exciting dreams for the future plan, whether it's pursuing your further studies, starting a career in health related, or even diving into research. So whatever the path you choose, I'm confident that the skills and insight you've acquired here will serve as a strong foundation for your future success. However, I would like to also to remind you that your contribution to One Health mission doesn't end here. And this program was not just the beginning of what I hope will be a long and meaningful journey of advancing to the One Health approach. Today, I would like to say that you are officially part of the SEAOHUN Alumni Network, a vibrant and growing community of professionals across Southeast Asia who share the same passion, commitment to making difference in human, animal, and environmental health. As SEAOHUN alumni, you are now connected to a wealth of resources, opportunities, and networks that will continue to support your personal and professional growth. I encourage you to stay engaged with us, not only with SEAOHUN, but also with our country network, such other OHUN like IndoHUN, POHUN, and I saw that PhilOHUN also attending our event here, and also our fellow alumni. We have many exciting programs, events, and opportunities on the horizon, and I urge you to take full advantage of them as you continue your One Health journey. So in this opportunity, I also would like to seek your consent to share your contact details to our OHUNs, our National Coordinating Office in each country, as well as to other interns, fellows in our program. So please keep an eye to also to our social media channels, website, and also you may inbox for our updates of what coming next. And as Maureen mentioned, this session has been recorded, and then we will be sharing through our media, website, and social media, you know, as a part of the information sharing, or also the encouragement for others, students like you, to take on to onboarding in the same program. So you please also share with them, disseminate as many as wide as you can. So together we can continue build stronger, more collaborative One Health community, one that is equipped to tackle the complex health challenge of today and tomorrow. Your journey is just beginning, and we look forward to supporting you every step of the way. And as we wrap up today's session, I would like to express my heart appreciation to all participants, our interns, host organizations, and OHUN representatives that willing to stay until the end of this program. And your contribution to this program are what make it successful. So let's continue to support and uplift one another as we work towards our shared goal of advancing One Health in our region and beyond. Thank you all once again of your time and your hard work and your commitment to One Health. And I look forward to seeing all of you achieve greater things in the future. Stay safe, stay connected, and stay inspired. Thank you, Maureen. Back to you.
Thank you, Auntie. Thank you for your closing words. And thank you, everyone, for staying late till the end of the session. So I hope you enjoy the rest of the great evening. Good night, and let's still keep in touch each other. Bye-bye.
Bye-bye. Good night, everyone.
Good night. Bye-bye.